Welcome to our series, Moving America Forward. Each week we'll be focusing on America's entrepreneurs as they take us to new roads, new opportunities, new ways to fill the gaps left by today's failing companies. Our series will be looking at that and a lot more. So come with me and watch as the entrepreneurs of our nation move into the future. I'm William Shatner, and you're watching Moving America Forward.
And I'm Doug Llewellyn here in our studios in Los Angeles with our guest today, who is the owner and the president of a company called Leading Edge Innovations, which is headquartered in Camarillo, California. His name is Paul Dwork. I'd like you to meet him now. Paul, welcome. Nice to have you with us.
Thank you very much.
This is a very interesting story, ladies and gentlemen. I think you're going to be fascinated by what you're about to see. To begin, a short while ago, you had a chance to answer some questions from William Shatner in a brief conversation with him. Let's take a quick look at just a portion of that right now and see how it went.
Okay.
Good to have you here. I'm very concerned about health care. The real issue is how do we keep Americans healthy? And I understand that is one of your goals. So tell me, what are you doing to help us stay healthy? Any new procedures and developments that help people to live more productive lives and in so doing move America forward?
Oh, thank you, Mr. Shatner. You asked if we have any new developments that help people live more productive lives. I'm proud to tell you that I have done exactly that by inventing a new product that solves one of the biggest problems for millions of American people. It is truly turning around the lives of Americans everywhere, and that, Mr. Shatner, is how we are helping to move America forward.
You know, you mentioned to William Shatner that you have invented a product that helps millions of people around the world. Tell me a little bit about what this product is and really who does it affect?
Well, it affects a lot of people. Male incontinence or urgency affects over 30 million Americans. Worldwide, it's 500 million people. It affects many people with many different disease states. You've got cerebral palsy, you have multiple sclerosis, you have Parkinson's disease, you've got spinal cord injury, you have interstitial cystitis. You have so many types of illnesses that cause incontinence. On the other side of the question and the coin you have people who are having urgency needs. Men that are getting older having large prostates. All of a sudden the urgency becomes more often and the unavailability of a bathroom being present.
So that's the problem. What is it that you have created to help men with this problem?
Now, the idea was to come up with something that would allow and give a man the independence to move on. And what we've created is a male external condom catheter.
You have a name for it. What's it called?
It's called GeeWhiz.
Okay.
And our slogan is, "You're in trouble without it."
All right. As we see on the monitor here, you're holding this in your hand. This is part of it. Explain how it works.
One of the ideas with it is it's a condom catheter that rolls on the shaft of the penis to seal the system. There were a lot of problems that were developed along the way in making a product. You have to work on the fact that when it's being worn, the fact that the nozzle may get bent. And if you look, you can see that if I blow on it, the air is coming out, which means liquid would be coming out. It's the only product on the market that will allow for a angular collection of the urine.
Yeah.
The second thing is how is the product held on? Created a silicone gel seal. And one of the issues is that although this looks sticky and tacky,
yeah,
if you notice, it doesn't stick to hair.
Right.
So this is a way of adhering the condom to the skin of the penis. And the idea is it's a wrap, roll, wrap. It's a 3-step process to put it on. You wrap the gel strip around behind the gland.
Okay.
The catheter is then rolled on over the gel strip. A minor squeeze. This is engaged. It fills in all the gaps and voids that are in the skin or wrinkles in the shaft.
So it, in effect, becomes liquid tight now.
Exactly.
Okay.
Exactly. The final stage of application is to put a secure strap around it. This is wrapped around the outside over the gel strip.
Okay.
which gives a constant pressure on the shaft.
Okay.
This will allow for different changes which may happen during the course of a day. Cold weather, different issues that may cause the shaft to shrink or enlarge in size. Now we have a system that cannot come off. It cannot come off unless it's disengaged and everything is taken off.
Okay, all right.
Your next step is, where does the urine go once it's eliminated?
Right.
And we have day bags and night bags. And I only brought a day bag, but it's for use day and night. So what we have is the ability to connect the catheter. And if you hear the click is a very important part. It gives the man a positive feeling because he can hear it click in place that this will not disengage and come off.
Right.
And then what you have is you have an entire system here of a catheter. This bag will be attached to the leg.
Okay.
At night, this would be disengaged. A larger leg bedside drain bag, which has 2,000 cc's,
Right.
would be put at the side of the bed and drained down to the side of the bed. One of the advantages also to a device like this is the fact that with this quick connect disconnect, a person can actually get up at night, go to the bathroom, come back, immediately connect it, and know that they have the safety of an airtight and watertight zone.
In other words, they can void and keep that on, but disconnect the bag.
Exactly, exactly. So there's a lot of advantages that it took a long time to develop a product like this. It took 6 years of development. Listening to people and what they had to say and why the problems were there. One would have thought that a condom catheter would be real simple. You roll it on, but it came off, it leaked, it kinked, it bent.
Right.
So all these things went into play. The silicone gel seal, which is what holds the catheter in place, will maintain the seal throughout the 24-hour wear. It's a daily disposable.
It's typically, you wear that typically for 24 hours.
24
right?
hours, yeah.
And this replaces diapers, depends, so to speak, things like that men have worn.
Exactly.
Which have many inherent problems.
Well, your diapers have, the main problem with the diaper is we're talking dignity. And dignity is a very important word. We're all proud. We all are embarrassed about problems that we have, and we don't want the public to know it.
Right.
And the thing is that urine has no odor. Only upon exposure to air does the urine become the ammonia smell. By keeping a closed environment here, we basically have a closed environment where there will be no odor. And when this product is being worn, there'll be no detection by anybody that you're around that you have a urinary problem.
You know, this is really pretty fascinating. And I know you've worked on this a while. I want to point out something here. This received the Medical Design Excellence Award in 2008, which is when you came out with this. You did an awful lot of work. This is a copy of one of the patents that you have on this. There are several patents altogether, many patents involved. How long did it take you to develop and invent this?
It took approximately 6 years to get it to the point to where it is today. And you have to understand that a product, when you come up with an idea as an inventor, and I as a pharmacist have a pharmacy, so the sounding board is the population of people who keep telling me the problems. Mm-hmm. Every time you develop a new product, you must try it out, and then you must listen to the public and determine what needs to be further done along the way to get a successful product. And there were 4 different permutations of products that were developed before I actually came up with this type as a final version.
And you actually had to go get the silicone gel developed and manufactured for you?
Everything is manufactured.
It didn't exist. You didn't go buy that off the shelf somewhere, did it?
No. This is silicone gel is purchased from one of the main manufacturers. Right. The catheter has to be injection molded. Your connectors have to be injection molded. So there's a lot of things that go into just making a simple product.
I have to ask you, what has been the reaction of men who have the problem and have used the GeeWhiz? What do you hear?
I think what you're hearing is, or what I'm hearing, is everybody has a different issue. Although the problem is the same, it's incontinence or urgency. Mm-hmm. The dignity and the problems that they're having emotionally is the fact that they want to get out of it. I had a gentleman in New York who called, and he loved the product, but that wasn't the thing that made his life a joy. What made his life a joy was the fact that he had not taken a walk in the snow for 7 years because his diapers froze. This was the first time he could get out. I had another person, the wife said that the husband would not go to the great-great-granddaughter's wedding because he was incontinent. He did not want anybody to smell him being around.
Right.
And got him on the product, and he went up and showed up for the wedding. So there's a lot of emotional factors that go into play in not just the product, but how it affects people, and it's strictly a quality of life.
Well, it's pretty doggone amazing, and it's getting widespread use now. Where is it being used?
Throughout the United States, I have hospitals that have adopted the product for use. Right now, hospitals, when patients are brought in, the first thing they do for surgical patients, or they catheterize them. Mm-hmm. Catheter patients develop infections, a good percentage of them, which can prolong the stay in the hospital. Mm-hmm. Therefore, by using this type of device, there are no infections, doesn't prolong the stay, and it saves the system money.
It just makes so much sense. What are your qualifications for doing this? It's just invented it out of your mind and said, look, this is something we have to do?
Well, kind of. I have a pharmacy, and my pharmacy is a sounding board. When people come in, I listen, and I hear the problems, and I take a look and see if I can fix the problem. This was a major one because the diapers are non-biodegradable. They take up, you figure a patient is using approximately 6 diapers a day, 180 diapers a month. And all of a sudden, you take 180 diapers and stack it up to 30 of these for a month's supply, and you basically have made a much better world.
Well, I must say, it certainly does make so much sense, and I'm sure there are many men who are really fascinated to hear about the existence of this. It's called the GeeWhiz, and it's available from your pharmacy or on your website. Right?
It's available at my pharmacy. I also have a website, which is www.urinedevice.com, and we do mail order throughout the United States. It's also been approved by Medicare.
Well, listen, I thank you for taking the time to tell us. This has been most interesting.
Well, thank you very much.
I'm William Shatner, and you're watching Moving America Forward.
This organization represents companies across our great nation that embody the spirit, dedication, know-how, and can-do attitude which has made America the great nation it is today. And now let's present the Keeping America Strong Award.
Now it's my honor to present this prestigious award to Paul Dwork, the owner of Leading Edge Innovations of Camarillo, California, for the outstanding work that he is doing to help keep America moving forward. Paul, congratulations.
Well, thank you very much, and I want to thank you for acknowledging me for this award.
You're very, very welcome. Richly deserved,
thank you.
Indeed.
That's it for another edition of Moving America Forward. I'm Bert Tenzer. Join us again as we continue to bring you the entrepreneurs who move America forward.
I'm William Shatner, and for all of us at Moving America Forward, thanks for watching.